Good day. So today I'll be going to perform Leopold's maneuver return demonstration. So Leopold's maneuver is a systematic palpation of the abdomen for assessing the fetal position and presentation. So now I will going to introduce myself to my client and establish report. Good day, ma'am. My name is Kevin Terrosa from Davao Doctors College, and I will be your nursing student for today. May I see your wristband, ma'am? Kindly state your name and your birth date, ma'am.
Thank you, ma'am.
So now I will go to wash my hands to prevent the transmission of harmful microorganisms. The next thing that I will go to do is to explain the procedure to the client. This is done to reduce the client's anxiety and gain cooperation during the entire assessment. So good day, ma'am. Today I will be going to perform a Leopold's maneuver exposing your abdomen and touching it. This is done for us to determine what position of the baby inside in your abdomen. Will that be alright, ma'am? Okay. So now I will be going to provide privacy to the patient by closing the door and the windows. The next thing to do is to let the patient empty her bladder before the procedure. A dilated bladder could cause the uterus to slightly deviate, which could produce unreliable results. So ma'am, kindly empty your bladder first before we start for us to get the accurate result of this procedure. So now I will go to position the patient on supine with one pillow under her head and with knees slightly flexed. This is done to facilitate accurate assessment and providing comfort. Flex knees relieve tension of the abdominal musculature. So ma'am, I will now going to place a pillow under your head for you to be comfortable. If right-handed, stands at the woman's right facing the patient. This is done to easily grasp the symphysis pubis and this is to be done for the third maneuver. So now I will be going to palpate the uterine fundus. This is done to determine what part of the fetus lies in the upper part of the uterus. So if head, it feels hard and round, freely movable and palatable, while breech it feels like softer and nodular. So now I will going to palpate downward to the side of the abdomen with gentle pressure. This is done to determine the fetal extremities position. So if fetal back, it feels like continuous structure will be felt. If extremities, it feels nodular, reflecting the portion of fetal extremities. So now I will be going to place one hand over the symphysis pubis and grasp the lower uterine segments using my thumb and fingers. This is done to feel the presenting part and a very gentle touch to move the head of the baby to determine if the baby is already engaged or floating. So now I will now turn and face the woman's feet. This is done to confirm the findings of the third maneuver and determine the flexion of the vertex after doing the procedure. So I have located the back of the fetus. This is done to listen for the fetal heart tone for 1 full minute using this stethoscope. So now notes for the location, rate, and character for the fetal heart tone. This is done to record the findings of the assessment. After that, makes the patient comfortable. This is done to reduce the patient's anxiousness and anxiety and for her to rest. So ma'am, we are done to our procedure in our Leopold's maneuver, ma'am. So now you can rest. Then after that, documents the observation made, the fetal presentation position, attitude, whether if it is engaged or floating, and this is done for the view of the findings of the physician. So now, ma'am, The baby's presentation is vertex and the baby's position is in left occiput anterior. So the baby's fetal heart tone is 128 beats per minute and it is normal. So the so now it is your baby is in complete flexion and the baby is floating. Thank you, ma'am.